Hey guys, Kim here, and you are tuned into Kim E, the Diabetes MP, a place where nurse practitioners can come and learn more about diabetes education and management. Now, today, I am recording this in January of 2021. Happy New Year, and I am so thankful that you guys have decided to tune in today because we are going to talk about something that is very exciting for the new year. We are going to talk about the updated standards of care for diabetes. Now, every year, the American Diabetes Association puts out an update of sorts of what the standard of care is for diabetes education and management. And this is used to guide us clinicians and providers as to how we should go about treating and managing our diabetic patients. So what I would like to do today is just to give you an overview of what some of the updates are. Now, before I do that, I do want to give a disclaimer, okay? Now, I am going to give an overview of sorts. I'm going to try to summarize this for you all, but let me strongly encourage you all to read the standards of care for yourself and to actually get into a habit of reading it for yourself every single year, as you would for any other chronic illness, and the guidelines that come out for that as well. As providers, we should stay up to date, and this is our way of doing that. In addition to going to conferences and taking courses and reading articles and being a part of newsletters and email lists, we should always every year just kind of go over all the different governing bodies that tell us what the guidelines are for hypertension, hyperlipidemia, dyslipidemia, and diabetes. We should all be in a habit of reading these articles ourselves, okay? Now, my desire for my platform, if you have been following me for any amount of time, you know that I really am intentional about helping nurse practitioners improve the way that they deliver their management to patients with diabetes, okay? Now, part of that, I am also very intentional with not spoon feeding you every little thing. Because here's the thing, guys. When you are in your clinic, you are by yourself. Okay, even if I worked with you or any coworker that you have to make those decisions for yourself. So instead of just telling you every single thing that you should do, which in essence is really impossible for someone to do for you, you really need to strengthen that muscle of critical thinking. And so my platform is never going to be, I'm going to tell you every exact step. Okay, I'm never going to be that way. So I want to mention this because I am going to give you what I deem is necessary, or not even so much necessary, but just kind of some things that I noted that were kind of up to date, or the things that they were really pressing in the ADA that we as providers should really press upon our patients and we should really implement in our practice. But you may read it and say, oh, well, she didn't mention this, or she didn't mention that, or she spent too much time on that. You know, read it for yourself and apply it to your demographic and the population that you see fit. So that's my disclaimer, is that yes, I am going to go over the standards of care, but I am not going to read it line for line. I will link it in the description box so you can read it for yourself. And I'm just more so going to highlight some of the main ideas that were put out this year. Now, also something else that I want to mention is that over the next couple of videos, because of the standards of care, I am going to make some dedicated videos for some of the things that are going to be brought up. So my goal by the end of January, that we all can understand what 2021 should look like for our patients with diabetes, and as providers, what the standard for us is. So if there is something, I'm really giving a very general overview today, but as the month goes on, I am going to go a little bit more in detail over specific points that I'm going to make today. Okay, guys, so let's get into it. So one of the things that I want to do is I do want to read a statement that the ADA put out, and I thought it was a very good statement, so I'm going to read it. And it says, effective behavior management and psychological well-being are foundational to achieving goals for people with diabetes. And I wanted to read this is because this is kind of what their opening statement was in the introduction before they got into the body of the whole article. And the way that they highlighted how we can go about doing this, effective behavior management and psychological well-being is basically summed up in 5 different subjects, okay? 5 different categories. And those categories are diabetes self-management, education and support, which is also referred to as DSMES. Also, medical nutrition therapy, also known as MNT, and physical activity, routine physical activity, smoking cessation, counseling when needed, and then lastly, psychosocial issues. So according to the ADA, we should focus in on these 5 areas when we're trying to sculpt a diabetes care plan and really consider these categories. And this is where they give some recommendations in these 5 different categories. So what we're going to do is jump into these different 5 categories, and I'm just going to pull out some things that I found very interesting and things that I feel that as providers, as nurse practitioners, we should consider. So first up, we're going to talk about diabetes self-management, education, and support. Now, the acronym for this that you'll see commonly used will be DSMES. Now, this is a biggie. Okay, now as I have been sitting down and just really trying to scour the internet over diabetes management and really trying to stay up to date as we're looking over the updates, this is something that hands down I see on many different platforms, the books, the articles that I am reading. This is something that is very, very important. Now, with DSMES, this is basically the practice of increasing the patient's knowledge, helping them to increase their decision-making skills so they themselves can better manage and self-manage their diagnosis. Now, this is something that is very, very important because there has been many studies, and there are so many results out there that show that when a patient is very educated and well able to manage their own diagnosis, we get better patient outcomes. Okay, the key is helping your patient to manage their diagnosis, and just flat out, the patient has to take ownership. Okay, the patient has to be the one that's driving the bus, the ship, the car, the truck, whatever. They're the ones that's driving the care that they get. We're more so like the coach, okay? Gone are the days where we're just barking out orders and our patients we're expecting our patients to just do what we say. That does not get results. Okay, the patient has to have buy-in. So your care really needs to be patient-centered and patient-focused over provider-centered. Now, of course, we can know what our end goal is for our patient, but we have to meet our patients where they're at. And this is where DSMES comes in, is really helping our patients to make better decisions when it comes to their care and managing their diagnosis. Now, this is one of those subjects that I am going to cover in the coming weeks because this is such a big task. Okay, this is really the foundation of diabetes care and management. And so there's more that I would like to unpack. So if you're not already subscribed to my channel, you would definitely want to be subscribed, ding the notification bell, because there is a video that I am planning to put out in the later weeks within this month that is going to unpack exactly what DSMES really is, and as clinicians, what our role is and how we can really better serve our patient population. Now, the last thing that I want to say about this is that with DSMES, you really want to focus on the behavioral change, okay? We want to change behaviors. We don't want to just bark out a whole lot of facts and statistics, and there's just knowledge, and we're getting our patients to do tasks. We want them, again, to have a buy-in, and the buy-in comes through behavior change, okay? And we get that behavior change through means of goal setting, okay? And again, in the coming weeks, I will unpack this more, but until then, I do want to direct you to a goal setting workbook that I created last year back in 2020. It is 100% free, and it's also a part of the NP Diabetes Starter Pack that I put together. I will put a link in the description box that you can download for free. You can print it off, and it's a 12-month goal setting workbook. But this is something that you can help your patients, help them start to set goals, and as well as you set goals for your clinic as well. Next up, number 2 is medical nutrition therapy. Now, the big takeaway here is that with medical nutrition therapy, we're trying to promote healthy eating habits, okay? Now, I have made videos, I think I did like a whole month of revolving around nutrition for the diabetic, but really when it comes here is that people can have very unhealthy habits when it comes to eating. We emotionally eat. People have, bad habits that were picked up from their childhood. And so really here we're trying to promote healthy eating habits, as well as trying to reach our glycemic control and blood pressure and lipid goals through nutrition. Okay. Now, something else that you want to consider are cultural considerations as well. We live in a country that is a melting pot of cultures and races and regions. There's culture tied to everything, and so you want to consider that when you're going through medical nutrition therapy. But you also want to the thing that I really love about MNT is that it also leaves room for pleasure when eating as well. One of the things that I see some health gurus, not medical professionals, but maybe like trainers and health gurus and stuff like that. And something that we have to dispel with our patients is that you can have a healthy diet and still eat good food. Okay? Let me say that again. You could still eat delicious food, but have a good diet. Okay? You don't have to eat like grass and dirt to eat healthy. And so you'd be surprised how many of our patients feel like healthy eating is just like salad. No, there are ways that you can cook your food that's healthier, but it's still delicious. And so definitely with MNT, you definitely want to bring on a dietitian, nutritionist, someone that can really help work through the different levels of nutrition with your patient. This would definitely require a referral. But then there is a level that we can do as nurse practitioners in the office as well. Okay, third up is physical activity, routine physical activity. Again, I have spoken about this before. I've made videos about this before, but basically some of this that was talked about in the standards of care for 2021 is not new, Now, just to remind you guys that any activity that is less than 3 times a week is considered sedentary. So definitely educating your patients on what sedentary is, because some people don't feel like they're sedentary. Well, if they're not at least being active, at least 3 times a week, then with moderate or vigorous activity, then they're considered sedentary. Okay. Now, something that, I do want to point out, that I do want to read off to you guys, because I made some notes here, is that there is a guideline. There are recommendations for children, because we do live in America, and in America we are seeing a high rise in childhood obesity. We're seeing diabetes, especially diabetes type 2, rise in children. People are starting to get diagnosed with diabetes type 2 earlier in life. Gone are the days that people are older being diagnosed with diabetes type 2. So when it comes to children, type 1 and type 2 diabetes, it is recommended that children at least are active at least 60 minutes a day, with some type of moderate to vigorous activity, whatever that may be. Okay. Now, something else, and I've mentioned this before, that adults should get at least 150 minutes per week of moderate to vigorous activity. Now, some guidelines with that: the patient should not have more than 2 days to pass before they have another session of activity. Also, if the patient is younger and more physically fit, their recommendation is 75 minutes a week. So not the 150, but the 75 minutes. 2 more things about physical activity. It is recommended that a person gets resistance training at least 2 to 3 times a week on those days that they're not doing like the exercise, the moderate to vigorous exercise. And then for our older patients, there is a recommendation for flexibility training or balance training 2 to 3 times a week as well. Of course, with our older patients, we know that they're more prone for falls, and so this will help build those muscles and help their balance. Number 4 is smoking cessation. So this is very to the point. It's not recommended for anyone to be smoking cigarettes, or even e-cigarettes. Okay. I still come across many patients who are trying to quit smoking, and the next thing they do is get on the e-cigs, and then now they're addicted to the e-cigs. So it's not recommended that anyone that has diabetes smokes or does e-cigarettes as well. And whenever counseling is necessary, definitely do that and help them work a program or a plan to quit smoking. All right. Lastly, we have psychosocial issues. Now, when we're thinking about psychosocial issues, we have to understand that this needs to be a part of every diabetes education care plan. Okay. Now, something that I think can be overlooked is that there's a lot of psychological things that are happening when people are diagnosed with diabetes, and those who have been diagnosed with diabetes. Okay. You have to address with people the stigmas that kind of surround diabetes, their fears, their attitudes towards the diagnosis. You have to understand as well that people can really take the visions and the past memories of maybe their grandmother who had it and had to get a leg amputated, or an aunt or a friend or someone. And so you really have to take some time to really dispel misinformation, as well as just hear people out. And this is really going to help you come up with a better care plan for people. You don't want to push people into something that they're not comfortable in doing. And again, as providers, we need to meet our patients where they're at. Now, you also don't want to forget that people who are elderly are more apt to deal with depression and anxiety. That stands true even if they were not diagnosed with diabetes. So we do want to make sure that we're screening and we're talking and allowing them to have a space to express how they're feeling. And then also, you do not want to overlook the population, our younger population. So our teens, our young adults, especially those who have just been recently diagnosed, because this is new. It's new. And we know with that age group, they are very, what is the word? They are very in tune with what others think of them. Okay, especially our teens and our young adults, those going into college. You want to definitely be screening them to make sure that there's no psychosocial issues. And if there is, that they're getting the proper help that they need and support that they need. Okay, guys, that's all I have for you. Now, again, like I mentioned earlier in the video, there were certain categories, certain points that I covered in this video that I am going to make a dedicated video for. So if you're not already subscribed and already have the notification bell on, you want to go ahead and do that, because I don't want you to miss those videos, because there are some categories that I feel that I need to unpack. And I want to make sure that everybody is getting the information that they need. Again, I am going to link the standards of care, the 2020 ADA standards of care, in the description box. I strongly encourage all of you all to read over them for yourself and apply as needed. I mentioned many different videos and many different resources in this video, so definitely check the description box as well, because there's going to be a lot of resources there. Now, again, you have been sitting here with Kim E, the Diabetes MP, and I will catch you on the next one. Bye.